So hi, good morning, everyone. We are meeting after a very long time. Today is 5th November, and this is 131st session of CMAAO International Weekly Meeting. And very good to see a wonderful audience joining in from various countries. I think it was a good break. And today we have a very important topic and a very important speaker, which I will introduce in some time. But before we can invite the speaker, she's having some technical issues in terms of her camera. So we can go ahead with some of the updates from the countries. If somebody wants to speak, what's going on? How is the COVID shaping up? If there is any other problems going on in the country, anything about vaccination, please do that. Can I start with Dr. Jamal Chaudhary? Jamal Chaudhary, Dr. Jamal Chaudhary from Bangladesh, and a very good regular, attendees for us. Go ahead, Dr. Jamal.
Thank you, sir. Actually, I became very much irregular these days because I had to attend a lot of meetings actually here also abroad. So I attended the General Assembly. Actually, I met Alvin and others also from Professor Shamizani also. And so it was a very nice meeting. Actually, regarding Bangladesh's situation about COVID-19, actually we are in a very stable position, which you can say now. The percentage of the positive infection is only 2 to 3%. Actually, those who are testing, actually, mostly a lot of people are not going for tests. But anyhow, everything is normally going here. Just anybody who wishes to have the mask putting on, and not much restrictions. But anyhow, in the meetings and closed door, especially gatherings, most of us actually wearing masks. The thing is that the number of deaths actually is also very less often. Actually, maybe weekly something like 5 to 7, 10 like this, are not more than that. So it's very much under control, and the vaccination rate is quite satisfactory. It's more than 80% actually now. Actually. So it's very good actually. And during monkeypox also, we are not getting any news from there. So this is the situation here. But the dengue is spreading much actually. It's very cause of worry now. Actually, so we are trying to control it now. Thank you so much.
Thank you, Dr. Jamal. Can I invite Dr. Alvin? Dr. Alvin, would you like to speak something on the topic? Also, if you can also cover what's going on the post-COVID effect. Are we seeing any patients with the?
Yeah. Yes. Hello. Good afternoon. This is Alvin from Hong Kong. Sorry, our clinic is still busy on Saturday, and in fact, because I had taken my weeks off from joining the WMA meeting, and then later on I had visited the German Medical Association as well, and so coming back to Hong Kong, our COVID-19 situation had been in quite a good control, in fact. So, in fact, the restriction measures in Hong Kong have been relaxed quite a while. And however, we still have to put on our mask in public areas. And also, we still have some restriction measures in public dining. However, I think at least the border control internationally have been relaxed a bit. That is, after coming back from Germany, I don't have to go into a designated hotel for quarantine for a week, and not at all. So now we don't have to be quarantined in a hotel after returning from overseas. And that is great. But of course, for other places, for Europe or America or Singapore, this had been released a long time ago. But then gradually, all right. So returning from overseas or tourists from overseas still have to have a negative PCR test on arrival in the airport to have the freedom to go around. That is, if there is a positive PCR result at the airport on arrival, the tourists or the citizens still have to be quarantined for 7 days. But then, if it is negative, and we could have a freedom to stay at home and also to go around to go to work, but not to have public um, dining for 3 days. Okay, but after the 3 days, everything's negative, then we can go around. So, but still, we still have to do 4 more days of the RAT test, and also on the 7th day, we still have to do a PCR test, and that is our measures in Hong Kong. We still have about 4,000 to 5,000 cases a day. Mostly now it's the BA5, and also we don't have the new strains coming to Hong Kong yet because we still have the border control until last week. So we just had an international financial summit in Hong Kong, and they started to allow all the guests to have the social gathering, the lectures, and also the dinners without masks put on. And so I think it's a good sign that Hong Kong could be returning to normal soon. We hope so. And but anyway, um, the mortality and the hospitalization rates are really low now, even though there are 4,000 to 5,000 cases a day. And that's why I think it's justified to further relax the restriction rules now in Hong Kong. Yeah, that's how we have the progress of the COVID-19 control in Hong Kong. Thank you very much.
Thank you, Dr. Alvin. This was an update from Hong Kong, and good to see that we have our speaker back. So we will start the session and we will continue with the update from all other countries, I think next week, since we will not have time this week. Thank you for update from 2 countries. Moving on to today's topic. As we said, it's on global health security and system strengthening, a very, very important topic. And one of my favorite speakers, Dr. Suneela Garg. She's a director, professor, and head of community medicine. She's an advisor to ICMR member task force. She works very closely with the Ministry of Health, Family Welfare, and Government of India. She's from Maulana Azad Medical College and Associates Hospitals, New Delhi. She has a lot of awards in her name, a lot of publications, and a lot of contributions towards the research. If I continue talking about her, I think the meeting will get over. So I will, without wasting more time, I will invite her for her presentation. Just to tell you, Dr. Suneela Garg, over here, there are more than 19 countries joining in. This is CMAAO, which where Dr. KK was president, and today we have Dr. Wazik from Pakistan, who is the president over here. Thank you so much. Over to you.
Thank you so much, Dr. Saurabh. I think I'm audible, and my dear colleagues from all the countries, 19 countries across the world. First of all, I'll apologize for the glitches in the digital media at the last minute. It happened. And let me just share my screen, because we are going to talk on an agenda which is now, post-pandemic. It's not, I'll say post-pandemic. We are going from pandemicity to endemicity gradually across the world. But now we have to think of one world. That is what I'm going to talk about. So I'd like to share my screen and I'll just see that about the presentation part. Okay.
Thank you.
Can you see my slide?
Yes, we can.
Okay.
Yes, we can.
So is it okay? Hello?
Yes, ma'am, it's fine.
Yeah.
Absolutely.
Perfect.
So, Dr. Saurav, now currently I am the chair of programs at National Institute of Health and Family Welfare. After this thing, I'm looking after some of the programs at MAMC, but closely working with the ministry. And as was being pointed out by Dr. Chan and other people, that if we look at 2nd November data, and also today's data, it's not very different. In India, we do have, a total of, active cases, which are 17,600, and 18 number of cases are there, and seriously critical are about 700 cases. And total cases per million population are 31,747 till date. That is important part to remember. But another thing which I like to say is that we still have the variant, which is Omicron variant, which is across, and it is across the world. That variant is coming in various forms, which is circulating. And so we have also vaccinated about 219 crore point 66, I'll say, vaccination doses have been given. And also we can say that almost our booster doses have been to the tune of only about 26%. That is there. So with this status, I like to say that across the world, there is a lot of inequity with regard to vaccination, with regard to the surge of disease, but it is or with regard to proceeding towards endemicity. So we need to talk now exactly, how we need to go now in the post, I'll say, when the pandemic is coming towards an end, but we need not sit down quietly. We have to look at various other things as well. So one is, as I said, Global Health Security Initiative, where, it is an informal partnership between countries and organizations. The purpose of this is to strengthen public health preparedness and response to threats of chemical, biological, radiological, nuclear terrorism, as well as pandemic influenza and other pandemics. Members are Canada, European Commission, France, Germany, Italy, Japan, Mexico, UK and USA, with WHO being the technical advisor. That is one of the important things which you have to remember. And also, the vision of global health security is to have a safe world which is free from threats posed by infectious diseases, because pandemic has taught us that the we can expect. We earlier had number of diseases starting from Spanish flu, then we had lately we had Ebola also in 1415, we remember. But we need to have one point in mind, that there has to be effective universal interconnection of stakeholders who are involved in mitigating global health security challenges, and we have to focus on strengthening our healthcare systems. So aim of global health security is that to assess countries' health systems efficiency and capacity for prevention, early detection, and appropriate responsiveness to health emergencies. Global Health Security Index projects that world is still unprepared for outbreaks of major infectious diseases, and countries should focus on factors like effective governance and a strong disease surveillance system. That is important, which should go on, and which we are doing in India through integrated disease surveillance project. So all countries across, and my dear members from 19 countries, and other participants, we should remember that surveillance is the core if we are monitoring, and if we have to look at the one world, one health part of it. And the role of global health security is that basically global health security agenda with CDC attempts rational upgradation in public health emergency management through disease tracking. Number two is surveillance system and training of manpower, which is very, very important. It also focuses on the threats to, basically detect in very early stages through surveillance and tracking system, and respond rapidly and effectively through improved medical measures and trained personnel. And then there is, we have got now GORAN, which is Global Outbreak Alert and Response Network, which is it aims to achieve the committed target of health emergency. New WHO emergency program was reformed, which was based on West Africa Ebola outbreak. It increased the core capacities in Africa Asia, Middle East was prioritized with standardization of country-level response and engaging close participation with GORAN, that is Global Outbreak Alert Response Network. Now we have got GORAN 2, which emphasizes on risk assessment and pre-pandemic preparedness, along with working on pandemic response measures. That is very, very important. And as far as global health security and India is concerned, in June 2016, we had Indo-US joint statement which reaffirmed commitment to global health security agenda and timely implementation of its objectives. And it focuses on 4 specific public health functions. And India is one of the active members of Global Health Security Agenda Group, along with 65 participating countries, 9 international and regional multilateral organizations, and with over 100 private companies and non-governmental organizations, along with academic institutions. And as I said, it has got 4 public health functions. One is, as I have been telling you, that one is to increase the real-time surveillance of potential public health threats. We have to strengthen our laboratories. We have to do the capacity building and skill-based training of our healthcare workers, whether we do it through the mode of technology or hands-on. So skill-based training is very, very important. And building rapid response teams which are capable of activating a coordinated emergency response. And also, in India, we are implementing this through, 3 centers, which is Manipal Center for Virus Research, National Institute of Virology, along with ICMR. India has actively contributed to 2 action packages. One is antimicrobial resistance, and second is immunization action package, where I showed you the number of immunizations were around 219 crores. That means over 20 million. And we need to also talk of, that India ranks, 57th with regard to global health security position, which is not very good. And we have to, see that how we can accelerate our up number in terms of global health security. And similarly, different countries, have to see where they feature in terms of global health security. So our main purpose is to train epidemiologists. We have to strengthen the laboratories. We have to focus on education and capacity building, our timely operations and response, along with CDC and Government of India. So 3 core things are there. One is to detect, prevent, and respond. And then if we see that, as I said, what are the contributions for global health security from India? The National Centers of Disease Control is creating the manpower in form of epidemiology intelligence services officers, and these officers are trained basically to assess and respond to epidemics. And we also have integrated disease surveillance platform, which has been refined to integrated health information platform, where the automated data will help in a big way in real-time data collection. And remember, this is the time where we need to talk of big data across the world and handling of big data and its interpretation. So it will also help in, the revised platform will help in analysis, data aggregation, and allow evidence-based policy making. And advanced digital platform will enable in identifying earlier signs of disease spread and outbreaks in small blocks or villages. And also, when we talk of, Global Health Security Agenda 2024, it will aim to be strategic with efficient governance and clear accountability. And as I said, we do need to have not only capacity building, we need to have financial sustainability, and there has got to be transparent collaboration across countries. That is important. So the core of global health security lies within these 5, I'll say, areas. One is monitoring, that is data surveillance, gather network. Second is diagnostics, that is laboratory network, along with the biosafety levels, stockpiles of vaccines, supplies, and medication. Then education, that is responders, and we must have, staff, and we must conduct regular mock drills. And another thing is we need to focus on research, and mainly it has got to be, also apart from basic research, we need to focus on operations research as well. So we need to gather data, focus on basic sciences and clinical and public health. That is important. So what are the active challenges what we are focusing today? One is that we are having multi-drug resistant organism across. This is where we need to be aware about. There is lack of public health integration in education, research, and care. There are disparities which are regional, systematic, and operational. separation of specialties as against summation of specialties. So we need to have, I also was a president to Organized Medicine Academic Guild, which is a combination of 14 professional associations. So idea is to bring, summation of specialties so that we can have a coordinated response. And we need to connect the core competencies. And but then, culture is the challenge which we need to address. So epidemiologists, clinical scientists, translation researchers, operational experts, all are required. And most important is whichever policy we have across the country for addressing the global health security, deep diving and policy makers are really required. Now we need to have focus on equality and quality and vigilant implementation and responsible accountability. Now talking about health system strengthening, we all know that COVID-19 pandemic has involved nations and incapacitated the health systems globally. The pandemic preparedness has been vested with immense losses. Universal health coverage is needed more than ever to recuperate from effects of current pandemic. And post-pandemic, many lessons need to be learned, especially for developing economy like ours, where public healthcare system is grossly inadequate to take care of health needs of the citizens. And this is where to reach the last mile, we have launched now Ayushman Bharat with the help of 1,50,000 health and wellness centers, of which 1,20,000 are functional now. Now there are 6 building blocks of health system delivery and which are applicable across the world. So we need to have effective leadership and governance, and which should be there from the top, and which especially which was demonstrated in this pandemic. At least I can say from India, when I was called to deliver a talk in Florida, that how 1 billion fought against COVID. So this is one thing where we must have leadership from upfront, and whichever country we are, we require the leadership. That is important part. And the second part is we need to focus on service delivery. We need to focus on human resources, medicines and technologies, financing, and health management information system is the one which is going to give us the real-time data. And the need of the hour is to have national health security plan, which needs to be drafted and available for health emergencies according to the countries. And we have Ayushman Bharat scheme, as I already mentioned. And the need of the hour is we need to focus on technology through telemedicine, mHealth, digital platforms, or apps should be contributing to trainings, supervision, and facilitation of healthcare delivery at remote locations. So this was one thing which we realized was a big challenge. And that is where, we launched in satellite through EduSet, so that, our capacity building can be done. We can address the needs of the people through digital platform. Now, public healthcare system and health manpower should be trained also in epidemiology now, which is the need of the hour, because we felt that, whether there was science involved across the world in dealing with the pandemic, we all were lost, somewhere or the other as to how to deal with the pandemic. So it is important that every pandemic now should be addressed with the public health perspective. And, the public health care system needs to be given a boost to have system readiness to respond in cases of future pandemics. Earlier in 2016, Ebola outbreak raised concerns about the poor preparedness of the healthcare systems globally, but still, we have a lot of lessons to be learned now from this pandemic. So today we talk of One Health, where it is not only, public health or the population's health or the ecosystems and individual health, but we need to focus also on the veterinary medicine, ecology, and environmental health, which will focus on all the infections, whether we talk of bacterial infections, viral infections, vector-borne diseases, or biothreats, or food safety. So we need to have, along with that, our inbuilt interventions like surveillance, control of vectors, sanitations, vaccines, and therapeutics. So another thing which is required is that we must have universal health coverage across, so that everyone everywhere should have access to essential healthcare services without facing any financial hardships. So the universal health coverage is one of the key features of United Nations Sustainable Development Goals. Now, the fate of COVID-19 in countries with well-vested health systems emphasize on the need for strong public health, which I am stressing again and again, and governments looking to develop sustainable capacity to respond to Rapidly spreading epidemics must recognize overlooked public health services as vital and adequately finance them as part of universal health coverage model, which all of us, need to look at as to, how much finances we have which are being spent on health and our GDP. That is important. So we have got, as I told you, about the 6 pillars, but we need to have also collaboration across the sectors along with health equity and outcomes, which should be closely monitored. So in the center is our community engagement. So we need to focus upon the governance and financing, health workforce, medical products and technologies, public health functions, and also health service delivery. That is important. So as I said, that one of the key pillars is, leadership and governance. And we need to focus on the importance of national planning and monitoring is critical for improved healthcare system governance. And we all know that we need to have a topmost agency in India. We disasters follow the protocols of National Disaster Management Authority under Ministry of Home Affairs. So these are one of the important things. An important part is that we do have a cell within the Ministry of Health and Family Welfare, which was established in 2017, which addresses the whole global health security agenda. Now, another thing is that we all know that landscape of public health is evolving, and we are focusing on new Public Health Act, which aims at constitution of public health authorities at national, state, and district level, and to repeal the Archaic of Epidemic Diseases Act 1897. It is to be updated by latest scientific provisions with the establishment of public health laboratories as well. Now, and the second part is we talked about the health service delivery and financing. So, healthcare model in India basically was designed to provide basic healthcare services, which was prioritizing on women and child health with an effort to providing access. But then now, under health and wellness centers, we have got 12 task forces, which are apart from mother and child's health and adolescent health, they're also focusing on communicable diseases, non-communicable diseases, eye and ear care, elderly care, health management information system. So like that, we have got, 12 task forces, and main focus is given to health management information system along with the service provision. And health and wellness centers are envisioned as foundation of health systems to provide comprehensive care, essential drugs and diagnostic services. That is important. So another thing is that the National Health Protection Scheme, we do have, that people who are below poverty line, they're given, protection of about 5 lakhs so that they can get, even their families can get health protection, through the secondary and tertiary care hospitals in the private sector as well. So this is envisaged to provide financial risk protection to poor and vulnerable families which are arising out of secondary and tertiary care hospitalization. Well-equipped staff and staffed health and wellness centers can contribute to close surveillance of outbreak in the catchment area and aid response measures. Now, treatment facility for the same is being made available at the secondary and tertiary care level of care with a dedicated contingency plan readiness in case of outbreaks. That is it. And we also know that now the pandemic has taught that there has got to be a dedicated space for the isolation wards to manage outbreaks of infectious diseases so that, our routine services should not suffer. That is important. And all across the world, we need to have protocols and SOPs when we talk of, one world, one health. So they should be available and technology should be shared. Protocols should be shared, in case of outbreaks and financial mechanisms. So, and then we must, these mechanisms must be in place to make the funds available to the health centers for immediate action. So India's GDP, basically as per still hovers around 1.5%. Right now it is around 2.3%, and during pandemic it went up to over 4%. But we have other ministries also, like Ministry of environment and different other ministries which are contributing indirectly, but we definitely need to have adequate finances across. And under investment in public health care definitely poses systematic challenges which we are, which we definitely need, rather I'll say the appropriate investment so that we can address the pandemics, correctly. So nearly, also we need to think of, in Indian settings, this has been a major challenge. So 52% of the households in urban areas, 44% of the households in rural areas have private sector as the main source of healthcare when they are sick. So at the time of pandemic, the catastrophic expenditures they rise because of high cost of healthcare by private healthcare system, which is unregulated by the government. And as the healthcare systems are overwhelmed, both direct mortality from the outbreak and also what we observed was that there was indirect mortality from the vaccine preventable diseases or from non-communicable diseases and treatable conditions like tuberculosis and all, they increase dramatically, and which is a phenomena across the world because we tend to have during pandemics our approach as vertical, which should be more horizontal. So that's how system preparedness is required. And also we know that, from analysis from 2014-15 and Ebola outbreak, it suggested increased number of deaths from measles, malaria, HIV/AIDS, and tuberculosis, which are attributed to health system failures, these deaths was much more than what we faced from Ebola. And it is also necessary to have specific list of essential services which need to be delivered and create a roadmap for progressive phase reduction. And India's surveillance data shows that recurring outbreaks of gastrointestinal disorders, dengue, hemorrhagic fever, as well as large-scale outbreaks of malaria, they point towards insufficiency in the efforts. And but then now, we are becoming more focused on the National Vector-Borne Disease Control Program, and, special focus is on malaria, where we are, particularly in Northeast and all that, where we have the dual challenge of falciparum and Plasmodium vivax. So this is where our environmental health also is very, very important. So another thing which is very important across the world is, as I've been talking about, health management information system, because we need to have a data which is needed for evidence-based decision making. So IDSP is the backbone, and the system needs to be further strengthened with capacity building of staff. And also, we need to have, syndromic and presumptive surveillance by the healthcare workers, which needs to be strengthened by continuously we have to monitor them, and we need to, continuously build them and train them. That is important. And also, it is important that, across the world, within the country, definitely we are a big country when we talk about 140, million people. So 140 crore people. So we need to think about that across the world also. Laboratory networks must be expanded with basic laboratory facility available at all the peripheral health centers, health and wellness centers of the country. And whichever healthcare facilities or the type of delivery system across is there, as I can see, in 19 countries, we need to look at how our laboratory networks can be strengthened, and there has got to be a network amongst them. And we need to improve access to information, resources, and state-of-art technology, which must be deployed to create integrated information and communication systems which links all the components of public health. Medical colleges, local public health structures, and private healthcare establishments all must have access to information, and there must be a mechanism of connecting them also, and they must be linked. And this will, this kind of, framework of data sharing will, facilitate timely guidance by the experts, and also, prompt actions by the authorities. That is important. And also we need to see that, we need to have the process of data transfer. Now the time has come where across the world we need to look at that our data has got to be, digitalized and in the form of electronic health records, which we have already started in our own country. As big data continues to develop, epidemiological and health outcome data will grow exponentially. This is what we have learned over the years, and especially pandemic has brought this into limelight. And information advances will have implications on the health workforce policy, with data programmers, analysts, and data scientists are being recognized as essential members of healthcare and public health teams. So that is where, apart from thinking of only doctors, nurses, and paramedical workers, we need to, now time has come where we need to think about, whether the programs are adequately, supported by data programmers, its analysis, the people who are going to analyze this, and data scientists. So these are going to be essential of people from the healthcare point of view. And also we need to think of, telemedicine technology. Through telemedicine, mHealth and digital platform can contribute to training, supervision, and facilitate healthcare delivery at the remote locations. Telemedicine has been utilized in an interactive health communication and disease prevention, disease surveillance, and disaster management. Another thing which is important is that recently our National Medical Commission, that means recently means, during the pandemic, because nobody was able to come out, people were not able to, interact. Standalone clinics were closed. Only the bigger corporate sector hospitals and, people who are there in medical colleges, district hospitals, and, sub-district hospitals, even health and wellness centers, they were working. But then, there was a need to communicate, but they were not interacting. So National Medical Commission, they came out with the telemedicine practice guidelines in the midst of COVID pandemic to avoid movement of people and crowding of healthcare establishments, and which is proving to be a boon now also, because many of the patients do not like to come, and that is where they are there on video calls with the providers and all. But of course, it also takes care of privacy between the provider and the, person or the patient. So both, have become very important. So all these guidelines are there, which are focusing on, privacy, confidentiality, and rapid interaction between the client and provider. So another thing which is very important is essential medicines, which is there to, and we all know that essential medicines are required to save lives, and, prompt actions have to be taken during outbreaks. But definitely we all need to also think of that every pandemic is going to teach us lot many things, but this is where the pandemic preparedness, needs to focus with the perspective of science. And during pandemic, we need to make sure that even whenever there are outbreaks, that means an epidemic also, having essential medicines which are readily available for distribution is very, very crucial for efficient management of surge capacity and to maintain continuity of essential services. The need for medicine and protective equipment will depend upon the emergency and the risk it poses. Another thing is that we all the, facilities, and at the national level we must have a broad plan, but overall at the hospital levels we need to have a hospital emergency response plan, including a sub plan, which is, along with the incident command group, to coordinate the hospital's overall emergency response. And which, pandemic has taught that most of the, I think almost all the facilities were lacking in this. So all of us should focus on the emergency response plans with the protocols which should be available for other essential services such as laboratory, food, water, electricity supply. If the outbreak is of infectious disease, then designated facilities should be listed for quarantine and isolation of patients. And also we know that, specialized health workforce, which I've been mentioning, is very essential. And our National Health Policy 2017 built on this theme and explicitly proposes creation of a public health management cadre, which has been already initiated, that is, by the government of India, just as recent as about 2 months back. And we also know that we are requiring multidisciplinary public health team, which needs expertise from all specialties, contributing to health of the masses, and not only those which are there with the medical knowledge. And we need to also focus on other systems of medicine, which are becoming very popular. Then another thing is that we know that, overall, when we talk about, the density of doctors, nurses, and midwives per 10,000 population is 20.6 according to National Sample Survey, and 26.7 based on registered data, which is less than, 22.8 per 10,000 population. But recently, when we looked at our Ayush system of medicine, homeopathic system of medicine, we have these also. So overall, we are able to address the need. But important is that not only availability, but, it has got to be trained manpower we need to focus on. Another thing is that, as I told you about, that we started our epidemiology intelligence services program in 2012, and which is being implemented by NCDC along with CDC Atlanta. And epidemiology intelligence program is a competency-based, specialized, yet practical training in epidemiology and emphasizing on significant and consequential epidemiology. So that means these officers are being trained on how to investigate an outbreak, and also it's hands-on training. They are, trained practically, in all sense of, understanding the epidemic, how to understand the healthcare delivery. So this is the need of the hour, I'll say, not only in India, but across the world. We need to have such officers who need to, have a clear-cut bent of mind in understanding how, when, where, what, why was responsible behind this pandemic. So all these things are becoming very important. Another thing, the pandemic showed us that, even our buildings were not very much prepared because of air conditioning and all. So it also it showed. So current pandemic, it focused on public health. Engineering was brought into limelight. So it showed because we saw that there was inability of the health establishments to cater to infection prevention control guidelines at workplace because of architecture and design of establishment. So public health is an interdisciplinary field, and engineering can solve public health challenges of water, sanitation, hygiene, air, water, and noise pollution and other environmental issues. So we need to focus on public health engineering also, which is becoming a very, very important area of concern, and which has not been addressed so far. And also, design and creation of public health facilities that ensures health and well-being of inhabitants, maintaining the standards of ventilation, lighting are essential. And we do have this document on, public health engineering, and I feel that which should be, referred by across, different countries. The training is also available as pre-service program through institutes of civil engineering, and in-service training through Government of India's recognized engineering and public health engineering institutes. So we dealt with, unpredictable virus, unpredictable human behaviors. Then, over a period of time, we changed our guidelines for COVID testing. And then, unpredictable policies were there, and accordingly the actions were there. We had also, unpredictable vaccines, because there we were had different lobbies. Some people said that this vaccine is going to be effective. Second is that they said vaccines are not effective. And, we had a lot of challenges. But in India, we dealt with, in a for quite some time, I'll say till date, we had, two vaccines, co-vaccines and Covishield. And we also changed the guidelines time and again with regard to medicines, whether it was ivermectin, whether it was with regard to chloroquine, whether it was regard to plasma treatment and all that. So the pandemic has taught us that, there are so many uncertainties with which we deal with. So better is to have a scope of One Health where we can, debate on where we went wrong and what are the issues which are required. So what are the take-home messages are: expect COVID-19 to be there with us for a few years as an endemic, and we learn to live with it. Future waves and impact will be governed by people's behavior, extent of previous infection, percentage and speed of vaccination, and variants of concern, which is PPPV. No perfect anti-COVID treatment is there, and mainstay remains the symptomatic treatment and steroids. COVID-19 has humbled all of us and made us proactive. Several things remain unpredictable and need out-of-box thinking, and our disaster management plan and global health security systems have got to be in place. So this is one of the, we had a public health webinar, which is, it were on unwavering COVID-19, and where we had record 16,000 registrations. And so it is a part of Organized Medicine Academic Guild. And Dr. Soumya Swaminathan was there herself as part of this meeting. So thank you so much for giving me this opportunity. If there are any questions, I'd like to answer them. Thank you so much.
Thank you so much for the wonderful presentation, ma'am. It was amazing. And I already see a few hands up for the questions. So we will go with Dr. Jamal Chaudhary. Your first question, please.
Thank you, Saurabh, actually, for giving me the chance. Actually, just a basic question, actually. We have lost actually more than 6.6 million people so far, and more than 637 million people have been infected. This is a huge amount, actually. We have lost a lot of people. And while visiting a lot of countries actually, just after or some months before, I have seen the people how they're taking this pandemic actually. Even in April also, I have went to Paris to attend a meeting of World Medical Association. There actually, when I seen the people in the reception, even in the five-star hotel, they are not wearing mask and very regular on this behavior. So I asked them what is the problem with you, and you are not observing the actually protocol. So they are answering that these are old people are just going to the hospital, not we. So, but they did not know even that they may infect their own relatives and their near persons. So this is the actually this is difficulty. And one question actually I asked in the last General Assembly actually, but it was not answered or it was not taken for the answer. This is a very important question. You have raised the point of this intelligence system, actually, epidemic intelligence system. Don't you think that we are lagging behind when WHO was advising us not to wear masks in general, but only the infected people should wear masks, and which actually we have just created a devastating situation. That why I don't know why it was not answered, and those who are responsible for this, why they are not taking into account. Because we are thinking that we are just escape that infection or the death, but we may face it in the future if we do not consider those things. And again, the source of the infection was not found out correctly. And I don't know whether, if you consider that market, this animal market of the China, where it has been originated, whether any preventive actions have been taken so that it cannot be transmitted again in some future in some other form. I don't know actually the answers. Actually, I just asked those questions, and we are just talking about the accountability. Whether accountability is there, you see the vaccines actually. I'm just raising these points, are very important points. For the vaccines, actually, what happened? Only those countries having the financial ability, they took that advantage of it. But later, when the tablets were just I think invented the tablets in the tablet form, something like so those actually they were allowed the third world countries, those who are having the facilities, they are allowed to produce. But why not the vaccines? Even the vaccines were the countries were capable of producing those vaccines also. So why those things can be answered? Why
Uh,
not? Why you have lost so many people? Thank you so much.
Yeah, thank you, Dr. Jamal, for raising, I think whatever questions you have raised and concerns across UN and in your different meetings, I perfectly agree with you. But one thing which is very important now, we have to talk, kind of in the same language. Because, health being a state subject, I can recognize this, as a public health person, we all talk different languages at different platforms and for us. So, if we say that mask is definitely there for everyone. If you remember, the first wave, mask was the only important social vaccine in India. When we introduced the vaccine, when we talk of 2020, we realized that during that time we had no vaccine before that, and it was masks which protected us, and the hand hygiene, or physical distancing, what we call it today. But another thing which you also raised is that we need to not only focus on the epidemiology, intelligence services and all that, but there are other issues like strengthening of laboratories. But also, I think about 4 days back, I was in a meeting where they said that, Dr. Garg, do you think that we need to relook at about the origin? I said, yes. You see, now since we are going towards the endemicity, we need to look at the origin of virus, where it came from. It is not, kind of expulsion on a country, but we need to look from a public health perspective. As to, we cannot say that it simply originated from the market, or somebody else came from another country and, brought the infection to the market, and then from there it went to, different countries. And WHO, let me tell you, was very slow in responding. The flights and all, when even the cases started coming as early as November, but we need to see 2019 when we talk of. So at that point of time, prompt action was required so that, we could contain the spread. But this is now looking from a retrospective perspective. So that's what I said. If we have one world, one health plan, which works directly in tandem with WHO, it's not WHO guiding the countries. It is now, countries have got enough capacities, so that we have to work together, in order to come to a decision. So this is one lesson which I think should be learned from the pandemic, that WHO, few people cannot decide. It's actually about it has got to be the intelligentsia from different countries which should be governing the pandemic, rather than few people alone sitting in WHO. Thank you.
Thank you.
Thank you. Dr. Akhtar Hussain, can you quickly ask your question?
Thank you so much, Saurabh, and thank you, Dr. Arvind, for giving us so much information on global health security. I got two issue and question. I like your slogan, One World, One Health System, but the problem is implementation, especially economic disparities in the health system, East and West. That is my concern. Will do anything to closing the gap? That's the second question is cyber threat in global health. What is your opinion? Thank you. Thank you.
Dr. Akhtar, thank you for asking these two very important questions. We know that there is inequality and inequity also across countries, and that's how, when we started with the vaccine Maitri program, and from India vaccines have been given to different countries. So I feel that that kind of phenomena should be approved. In this pandemic, what we observed was that we ourselves were fighting for vaccines in the beginning, and when we had a dialogue with Moderna, Pfizer, and countries like United States and all, initially, though vaccines got wasted, but it never was shared with many countries. And if we think of origin of Omicron, which was there in African continent, where only 3% were, the population at that point of time was, only vaccinated. So the lessons to be learned is that all countries are, in India, I always say that, I am protected only when my neighbors are protected. So that phenomena of one world, must hold, true in correct spirit. And we need to kind of look at from that perspective. And each country, I think, whichever is the size of the country or the financial status, we must have a voice. That is important. And we must have a voice across the regions that is there. Southeast Asian region, or, Asian region, or, we've got different regions across the world. So somewhere, even the pandemic has demonstrated that whether, people were there in United States or in United Kingdom, where, still people were not able to deal with the, surge. That is one thing which has to be learned from this pandemic. Unless we have the phenomena of one world, we will not be able to address, because our borders are transparent and porous. That is important. Your second point regarding cyber threats, yes, we need to where the technology is there, it has got its own advantages. But definitely, our focus, when we talk of epidemiology intelligence also, it must take into consideration cyber threats as well. Thank you.
Thank you so much for your
And
reply.
I'm Dr. Suneela Garg, and by chance, my husband's this thing is coming, Dr. Arvind.
I just changed the name after listening that.
Yeah, because, last minute I changed my laptop. Thank you so much. Thank you.
I did change the name of yours there.
Yeah.
I have to figure it out. Anyone else has a question? Dr. Monica or Dr. Vazik, do you want to have a comment on it? Dr. Monica?
Dr. Garg, thank you so much for a fantastic presentation, and to really bring out a post-pandemic or endemic world of how we can all work collaboratively. I understand exactly what you say about how we need to approach now with a retrospective lens as to what has happened, what worked, what didn't work. How does that apply to your own local communities, and how it applies to the world at large? There's a lot of work to be done. This is just one pandemic, but we can take the lessons that we've learned and apply it to so many other issues. For example, with vaccine equity, we see now that there's a new RSV vaccine that's coming out. How can we take what we've learned from the pandemic and apply it to the access to this RSV vaccine, and which children will benefit from it? So I feel that what your lessons you've said were very, very astounding. You had beautiful slides. You had so much information that you shared with us that we would love to go back to it and look at each of those components individually. So thank you very much for everything that you shared today.
Thank you, Monica. Thank you so much.
So anybody else want to say something or any questions before we wind up the session? It's already 10:40 over here.
Yes, Saurabh.
Yes. Yes, Dr. Bazik.
This is Dr. Qazi Wasiq from Pakistan. It was excellent presentation, Suneela.
Thank you so much.
And I think you have covered almost everything in it. And we have learned a lot from your presentation. And I think we need to take it to the policymakers, especially in the health sector. And I think this presentation should go on for those policymakers as well, who really governs the health sector in the countries. One thing I would like you to ask is the upcoming threat of climate change and the global warming and the environmental. You have covered the health engineering as well, and of course the environmental also. But this is the biggest threat which is coming up is of course the climate change, the urbanization, and the green acres are being transformed into concrete jungles, and we are reducing the living space for the animals, and we are literally poking into their land as well. And there will definitely be more viruses coming up from animals to humans. And this is a very important issue, I think, for the coming years. We need to work on that. We need to change the world with the threat of climate change and global warming. Your comments.
Yeah, thank you, Dr. Vasik. I agree with
Dr.
that.
Suneela, can I just, in addition, so that you can answer this, if Saurabh allows me, actually, this is actually, we're just observing the monkeypox has spread in a very different way, actually, in comparison to the previous time. It has infected a lot of people now, actually more than, near about 20,000, something like that, or more than that, so far I remember. So, and again, the Ebola I have seen, it has also increased much. So does it have any connection with some sort of environmental factors or climate change or something like that? Do you think of it? Thank you.
I think, first of all, I'd like to say that, Dr. Vasik, climate change is something which needs to be addressed. And particularly when we talk of climate, we need to look at all the factors within the climate and all the, when we talk of air pollution, when we talk of, water pollution, we talk of noise part. Environment actually has, and the climate as a whole needs to be, climate as a whole needs to be, kind of addressed. Climate change, something when we talk of global warming and all these issues, they need addressal at every platform. There's no doubt about it. But then, the issues which can, to some extent, how we can protect, from air pollution or from, water pollution or noise, but these are some things which are, or, indiscriminate wastage of water, particularly when I say in countries like, developing countries like ours are, which are moving towards, the development. So these factors are very important. When I brought about this issue of One Health, and where I talked about, apart from the, humanities, it is the veterinary sciences, which is very important. We need to look at that part also. And because global warming is now an important issue of concern, and we need to look from the epidemiological perspective also, the linkages of different diseases. It's not only, we talk about, as I mentioned, about gastrointestinal diseases and all that. And plus, as we are going ahead with the, I'll say the countries of concretes, we are going to, we have to see that somewhere we do not, evade upon, the spaces against where this is where is the role of the government. That's my own view particularly, and that's my view from the ministerial point of view also. And Dr. Jamal, you raise a very important issue that whether we are focusing on human behaviors, because it's not only the medical science, it's the social science as well. Because when we talked about, the issues like monkeypox and all, we saw that it was more there in, people with bisexual and not quite a number of cases we saw in that. So we need to bring about, specialties together. It's not only the medical sciences, but social sciences also, which needs a debate. I think, when I focus on this topic, I thought that we will start a kind of a broad session, and within this we can have pieces on which we can debate more at length, and very, very important issues which you have raised, all of you. It's my pleasure to be, answering to them. But then there's no single answer. We need to go more. As I said, that policy diving is the need of the hour now.
Thank you.
Thank you, Dr. Garg. So I would say, I think this is the end of the session. We have no more questions. I just want to highlight a comment from Dr. Angelica Koji, which she has to leave the meeting just 10 minutes back. PHCs and more investments in GPs and nurses are very important. Also needs to have GCs in decision making. She was the person who discovered the Omicron variant in South Africa. And we have a whole South African medical team over here. And obviously Dr. Monica from US, apart from CMAAO sessions over here. So with this note, I would like to thank and also invite you in one of another sessions as a follow-up sessions, probably after a couple of months or so, whenever you have scheduled, Dr. Suneela Garg. So thank you so much for enlightening us with your knowledge, and we look forward for many more sessions with you. Thank you so much, Dr. Suneela. Thank you.
Thank you so much. Thank you.
Thank you.
Thank you so much. Thank you.
Thank you.
Okay, thank you, Sarab. Thank you, Monica. Thank you, Suneela. Jamal, to see you.
Thank you, Dr.
Everyone.
Kazi.